Hello, everyone, and welcome. We're so excited to have you here today for our first ever webinar with Cheng Plastic Surgery. We have a great presentation prepared to educate you all on our newest laser device. We'll explain how it works, what it treats, and why we're so excited. If you've been considering laser treatments or are curious about the latest advancements in aesthetic technology, today's session will give you a clear understanding of what makes UltraClear unique. We'll also reserve time at the end for a live Q&A with Dr. Cheng and Kevin, so feel free to drop your questions into the Q&A box at the bottom of your Zoom screen as we go. If you experience any technical difficulties during the webinar, you can use the chat feature and I'll be here to support you. Also, be sure to stay with us through the end. We'll be sharing a special UltraClear promotion available exclusively for attendees. Before we get started, let me introduce you to our wonderful speakers. I'm pleased to introduce Dr. Jacqueline Cheng, who is a double board certified facial plastic and reconstructive surgeon and the co-founder of Cheng Plastic Surgery, where she specializes in advanced facial rejuvenation and laser technologies. With more than 20 years of experience in aesthetic medicine, Dr. Cheng is known for delivering natural-looking results and for bringing cutting-edge innovations like the UltraClear cold fiber laser to patients seeking effective skin rejuvenation with minimal downtime. And also with us today, we have Kevin Nguyen. Kevin is an aesthetic nurse practitioner at Cheng Plastic Surgery, where he focuses on aesthetic medicine and advanced skin rejuvenation treatments, including laser technologies like UltraClear. Kevin brings a patient-centered approach to aesthetic care, combining clinical expertise with personalized treatment planning to help patients achieve natural-looking, confidence-boosting results. And also today we have Adina Wittekind, who is our patient care coordinator at Cheng Plastic Surgery. She's here to tell you today a little bit about her personal experience with UltraClear, and when you come in for your appointment, you'll probably see her and ask her some questions as well. And for now, everybody, I'll pass the baton over. The floor is yours.
Welcome, everyone.
Thank you so much. Hello, everyone. Thank you for spending your evening with us to learn about our new device. Really appreciate that you guys are here instead of at the BTS concert. So what we're going to talk about today is UltraClear. And again, this is the new laser we brought in. As you know, my brother and I always look at new technology, and we always try these different technologies to see what is going to be best for our patients. And so the latest one is UltraClear. It is a cold ablative fractional fiber laser. And we're going to talk about that in just a moment, what makes it so groundbreaking. So, everyone is a candidate for UltraClear. In our practice, we have a lot of different ethnicities. And again, it's for everyone. It can help with uneven skin tone, texture, fine lines, wrinkles, acne, and surgical scars, pigmentation, sun damage, age spots, and just overall skin rejuvenation. And we're able to do it with UltraClear because we can really fine tune and decide what treatment will serve you the best. And we'll go through some of that in just a moment. The benefits of UltraClear is it is more comfortable than some of our other laser treatments. It also will address multiple problems. We can tailor the treatment to make it specific for your concerns, and it can be a very quick treatment with a quick recovery. Now, again, that depends on what we're treating and how deep we're going, and we can adjust all that with the UltraClear. Okay, so one of the most important things that we as practitioners look at is what skin type are you? Now, what this means is how much pigment do you have in your skin? Because we have, again, so many different ethnicities. The type 1, which is a Fitzpatrick scale, the type 1 Fitzpatrick is really someone who is Irish, Scottish, kind of that Northern European where they burn in the sun and they don't really tan at all. And what that means is you don't have very much pigment. You're actually an ideal candidate for any laser treatment because you're not going to discolor on us after the treatment. Now, a type 2 is someone who burns first and then may tan. So you've got a little bit more pigment than the type 1 patient. The type 3 is someone who tans and really doesn't burn. Now, when we get into the type 4, type 5, type 6, these are the ethnicity, oh, sorry. These are the ethnicity, I can't say that word, but anyway, um, these are the types where we have more pigment, and we really have to worry about what laser we're using for you so that we don't cause discoloration. And this is why we brought in UltraClear, is because we want to be able to treat against, again, all skin types. So Asian patients tend to be type 4. Latinos tend to be more type 5, and then kind of the African Caribbean skin tends to be more a type 6. So let's talk about like kind of the different layers of your skin and what we're treating. So UltraClear has so many settings that we can play around with. The 3D Miracle is for all skin types. It's really taking off that top layer of dead skin. So kind of with helping the pigmentation, the texture. When we start going into ultra clear, we're going deeper down into the lower epidermis and into the dermis. And that's where we're going to get a little more tightening, helping with some of the like the deeper lines and getting, again, some tightening and overall resurfacing of the skin. What we're super excited about is laser core, where we can actually core out like these really small areas of tissue, and that's really going to help firm and tighten your skin. So that's something we're super excited about because that you're going to see much more tightening with that. So you can see all the different things we can bring in or do to your skin with Ultra Clear. And this is why we really would love for you guys, if you're interested in Ultra Clear, to come see us for a consultation, because it's our job to decide and come up with a program that's specific for you. So we just wanted to kind of simplify like 3 levels of treatment with Ultra Clear, like a superficial treatment with 3D Miracle. Again, it's going to help with skin glow, texture, sun damage. There's really minimal downtime, safe for all skin types. This is the one kind of like it's again, just a glow up for procedures. We can do this. You do need a series of these, and we tend to do it once a month. You might not even need numbing for this one. A more moderate procedure, we're going deeper now. And so we're helping address kind of the fine lines, deeper wrinkles, acne scars. As we go deeper, there is more downtime, 3 to 5 days. We can tailor it to all skin types. We still have to be a little bit less aggressive with our darker skin types, and with our skin types 1 through 3, we can be more aggressive. But the more aggressive we get, the more downtime you're going to see. So with laser coring, as that's our most aggressive, we're really going to get even more tightening. But so you can see that the downtime can be 5 to 10 days. It is only for our skin types 1 through 3. There's just too much damage. The risk of discoloration is a little bit too much for our higher Fitzpatrick patients. So I don't know if you guys all know, I've been in practice for over 20 years now. And when I first started getting into aesthetic medicine, when I was in my training, we did the traditional CO2 laser resurfacing. And that's when we took that whole top layer of skin off. It was a guaranteed 2-week recovery, but it did help tighten the skin. It kind of made kind of a waxy appearance, but it really helped with wrinkles. But again, we could not do that on our higher Fitzpatrick skin type patients. So through the years, as technology has improved, we were able to start treating more the higher Fitzpatricks, but also decreasing the downtime, because who can take like 2 weeks off to recover? And so with UltraClear, it came out fairly recently. And again, we're so excited because it can treat all skin types, and we can again tailor it to everyone's needs. So one of the things with UltraClear, and the reason why we can treat all skin types, is it has this 3D IntelliPulse technology. And what that means is, if you see the arrows, it fires heat, but then it cools, and then it fires more heat. So what it's doing is it's preventing the heat from being trapped in the skin, and it's not, if not as much heat is trapped in its skin, not as much heat is spreading to around the site of injury. That makes recovery faster, and it also makes it safer for all skin types. So this is something that we do not see with other laser technologies. This is just kind of giving you a quick glimpse at how the treatment goes. I mean, we set it up, we figure out what settings we want to use. We protect your eyes from the laser energy with, here they're using some laser shields, but we use goggles. And then it delivers this pattern on your skin where it's delivering the energy. This is different from a traditional CO2, because a CO2 would just wipe off that entire skin. But you can see that there's some areas of skin that is not treated, and that really helps in the healing process. Think of it as if you're getting like a little needle poke, that needle poke heals very quickly. And that's kind of what UltraClear is doing. So, and you can see it's easily done in the office. Pain is really dependent on what your concerns are and how aggressive we get. The more aggressive we are, the more discomfort you're going to have. The less aggressive we are, the less pain there's going to be. And again, less recovery. I'm now going to turn it over to Adina and Kevin to kind of go through some of the before after pictures, and I'm happy to answer any questions at the end of the webinar.
Welcome, everyone. So this slide that you're seeing here is actually my experience and recovery. Having been with the Chengs almost 16 years now, I've done many of our treatments, ranging from, Botox to our non-invasive, skin tightening, thermage, therapy, as well as, Fraxel and the CO2. Now, the CO2 and the Fraxel, I've always avoided my face because I have melasma. And so I was always super worried about that melasma becoming an issue again, because I had it really under control. And so with this laser, I was super excited because I wanted to see the benefits of the skin tightening and just pore reduction and just overall good skin health, right? And so that's what I got from this. So it was definitely more comfortable. I did face as well as neck. We numbed the treatment, did it in office. I medicated with some Tylenol before the treatment and numbed for about an hour. And so what I experienced during was comfortable heat, but tolerable. And afterwards, a little spicy, similar to like a CO2, in that it does feel warm, but manageable. And so we have a great protocol in the office that you're going to, that you're going to follow as far as Epicutis products that are really going to help with that skin barrier. And I felt like, yeah, it was really tolerable. And so the next day when I came in, pretty swollen, but felt comfortable coming in, to work and chatting about it. Using the lipid mask again helped calm the skin as well as just comfort and cool it. And then by day 3, you can see in the slide, the swelling's already coming down. By day 1 into the evening, we didn't post that photo, but the swelling was already coming down that second night. And then within a week, I was out socially and no problems with that. Now you're seeing the 1 month photo here, but what I'm noticing even more so now, I did the treatment at the beginning of March, and I'm starting to see just more tightening overall with my eyelids. We had treated just the upper eyelid over the brow as well as the lower. So I'm noticing that as well as my folds just softening. So super happy with the treatment. Excited about honestly doing it again and when I can. I think the most important thing with the treatment is knowing that your results will continue to improve. So they won't be, your final result is not your final result, even at this point, because you are building collagen. And that does take about 3 to 6 months for you to start seeing that. And then again, depending on the modality that we're doing, you may be a candidate to retreat again at 6 months or a year. It again just depends on how aggressive and what we're treating. Some are going to be sessions that we're doing. But again, you'll have a consultation for that, and then your provider will decide which modality is going to be best for you. Kevin? And then here's the other, again, what was nice about this is actually using our Visia. And so with the Visia, you're able to see your pore size, your wrinkles, redness. And again, what I'm noticing the most when I see this is my skin laxity improvement with the upper eyelids, as well as the pore size shrinking and the folds as well. So really, really happy with what I'm seeing. And again, that photo is just 1 month after.
All right, thank you so much, Adina, for that. And now I want to go into the different levels of treatments that we have, along with some before and afters. So just really simplify it for our patients. We have broken it up into 3 different levels of treatment, and each patient, depending on their goal and how much downtime they're looking for, will fall into one of these 3 levels. We'll start first with the superficial. This can include different modes to reach your goal. So superficial, we actually treat one of our patients here, and she's a young patient. She didn't have too many concerns, but her main concern was texture. So pores, think rough, bumpy skin, and she even gave us a testimonial. So I'll go ahead and play that video for everyone to see.
Hi, I'm Elizabeth, and I just did our new UltraClear laser here at Cheng Plastic Surgery. It felt like kind of almost like when you get a tattoo where you can feel like the vibrations, but you cannot feel the pain at all, and they do numb you prior, so it was honestly painless. Yeah, for my main concerns, I had like texture around my skin, so I was really focusing on just fixing that texture and getting like a smooth base overall. After, I did feel like the trapped heat. It did last for the night, but nothing unbearable, more just uncomfortable. For me, I think it took like a total of 3 to 4 days. On the 3rd day, I was still kind of peeling a little bit, but on the 4th day, my skin was completely clear. It feels like a baby's bottom. I don't think I've ever had my skin feel this smooth, ever.
All right, so that was a great testimonial from one of our patients. And this just also shows her progression from her before picture to day 1. You can see she's starting to have some of that redness pop through and peek through, but then by day 2, it starts to get a little bit more red. But if you can see the progression between days 2 to 5, it's a huge improvement. I mean, she's almost fully healed by day 5. And you can just see that glow in her skin from the before to day 5. I mean, she didn't have much going on before, but you really see by day 5, she just has that glow that UltraClear can really provide for the patients like this. So really great results and happy overall.
I just wanted to mention that, on day 1 and 2, you kind of see like little boxes. That goes away. That's just, we call them track marks, but don't be concerned at all. They go away.
And we'll just go over a few more before and afters. So this patient also had just the superficial level of treatment, and you can see improvement 1 month post. She only had one treatment done, and there's improvement in her hyperpigmentation, could be from acne. And then just overall, her skin texture looks smoother, and she has that glow. Not extreme where it's like a waxy, strange kind of glow, but she just looks like she's glowing from within. And that's really the purpose of this treatment for patients who are just wanting something with minimal downtime, little discomfort. Some patients don't even numb for it, and they're able to get these kind of results just with one treatment. Here's another patient. She has quite a bit more sun damage than the previous one, and even a little bit of redness too. And this laser can actually treat some underlying redness as well as sun damage. So she got a great result after just, again, one treatment 1 month later. Huge improvement in her hyperpigmentation. Some of those are freckles, and even in her redness as well. Next treatment here. This patient also had, again, a superficial level treatment, and you can see nice improvement in her brown spots. If my cursor is working, you can see this brown spot has completely disappeared, along with some on her cheek as well. And it also evened out her skin tone, some of the blotchiness, took care of that redness, and she's glowing in her after photo. This is a great before and after. So, living in the Silicon Valley, we're always glued to our phones and our laptops, so we have definitely that tech neck going on for anybody. And so this patient had a bit of sun damage in that area, and you can really see how it emphasizes the horizontal lines. It looks deeper, it looks more darker, in the contrast. And after just one treatment, 5 weeks after, there's significant improvement in the way her neck looks. It looks rejuvenated, it looks brighter, more even complected. It even hides some of those horizontal lines. Even though this isn't a treatment meant for skin tightening, but just by treating the underlying pigment, it improves the overall look so much. And this is a great example of how this laser is really made for everyone. Here at Cheng Plastic Surgery, we have so many patients of higher Fitzpatrick. So again, those are patients with deeper skin tones. For example, your Asians, your Latinos, Hispanics, your Indian, Middle Easterns, and of course, even African Americans as well. And this patient had great results where she had some hyperpigmentation here on her forehead. And also you can see a bit of texture down here as well, and that improvement afterwards. Her pores look tighter, she's glowing, and a lot of improvement in her hyperpigmentation.
This is a patient that we would never do a CO2 on.
Correct. And this is why we're still in the first level of treatment, really superficial, and this is a way to safely treat these patients here. Again, showing another patient, I believe of Asian descent, and this patient in her before photo, you can see some hyperpigmentation, some underlying redness, and even a lot of texture too. Could be from old acne scars, for example. And afterwards, just one treatment, you can see her skin is much smoother. A lot of that pigment has lifted, and even her redness has calmed down quite a bit. And this is quite amazing just for one treatment on an Asian patient.
And this is only 5 days after treatment. Just imagine like we can get even more improvement with a series of treatments.
Absolutely. I mean, with a treatment this light, you definitely want to think about working it within a series. So, for example, one treatment on a monthly basis, 3 to 4 treatments are typically average, and that way you get optimized results. This is another patient. It's a bit more focused. This patient has a hyperpigmented lesion on the corner of her eye. And you can see just with, I believe, 2 treatments in total. Yes, 2 treatments and 4 months in the after photo, it has almost completely resolved. So this treatment can be done full face also as a spot area as well for more focused indications. And it's just great overall for hyperpigmentation.
This is an example, kind of an age spot. And as we get older, we get those.
Mm-hmm. Okay. This patient has hyperpigmentation down on the lower face. They the main thing about this patient is that we want to really emphasize how it's safe for, again, deeper skin tones. So you can see on her before photo, she has quite that deeper olive skin, and just showcasing how safe this laser is for all skin types and the improvement she has after 2 treatments and 10 months post-op.
This is someone that I would say has melasma. Melasma is a very difficult condition to treat because it's multifactorial. Um, there's environmental, sun, genetic, and also hormonal. And so we can never clear melasma completely, but this sure did a nice job in really lightening that melasma.
I believe this is the same patient, and to Dr. J's point again, it does present as melasma because it is bilateral and showing on both cheeks. So it does present as melasma and it is safe to use, but we would just pretty much stay at this level of treatment. The deeper and more advanced that we go, there is higher risks. So that's why consultation with your providers here is so important, because melasma is a multifactorial type of disease condition where we're going to have to use a couple different modalities combined together to really treat it well and get it under control.
I mean, the goal of melasma is just lightening. We're never going to get rid of it.
Yeah. It is a chronic skin condition, but we've had great results here with patients. When we do combined treatments, we're able to get it very light to where patients are using less makeup, having to use less coverage. And for a lot of patients, that's a huge deal. They don't want to be caking on layers and layers of makeup to make their skin just look even. So if we can even get it a little bit better, I mean, they're super happy with the results.
Yeah, and I think that's an important point to make also too, just being able to offer the different modalities to really address your skin issues or your concerns, I think is really important. And knowing that, yeah, you have options and what will be the best for you. And just making sure that, as we get older, I turned 50 this last year. And so it's a big birthday. And I find that, my biggest compliment that I get from people is how great my skin looks. And that really is, I mean, a testament to just the treatment and skincare. It's like we often forget, sunscreen's your number one thing. And so you want to make sure that you're doing that most importantly. But as we are aging, what are those issues that maybe weren't present to us when we were younger, but are starting to, show themselves now? And so yeah, it's just great that our providers are really good about that, and have the experience to deal with some of those issues that do arise.
For sure. And to Adina's point, I mean, so many people focus on lines and wrinkles as a sign of aging, but we also have to think about age spots too, and hyperpigmentation and how that plays a role into aging as well. Your complexion, which means, how clear your face is, plays a huge role in your appearance and how people think as far as age goes. So, I mean, being able to clear that with a laser like this will make a huge impact in your overall look and complexion. Okay, we're going to look at some more before and afters, and this laser is safe and indicated for off the face areas. This is a great example of it being used on the hands. We always are always really good about mentioning to patients how the hands and the neck really show our true age. So we definitely don't want to neglect those areas. You can see there's quite a bit of sun damage on the hands in the before photo, and just 5 months post-op on their third treatment, it's significantly improved. Not only are the age spots removed, but the overall tone of the hand it's a lot brighter and lighter, and even some skin tightening as well too. Even though it's not really meant to be, but you do see just the texture looking a lot smoother overall.
Yeah, I think for a lot of patients, it's, above the knees is a concern, elbows, chest, things like that, even abdomen for some, that it's laxity that they're noticing. For patients that have had tummy tucks, improving on that scar, this laser again is really good for those areas.
Not all lasers can be used off the face. The face is very forgiving, but when you get down to body, it's not as forgiving. So it's one of the benefits and why we brought this into our practice.
Okay, now we'll go into the moderate level of treatments. And just to recap, your superficial is going to be really working on really just skin texture and some really light hyperpigmentation. Patients who are just wanting that really quick glow with minimal downtime and very little discomfort. Now, the moderate level treatments are going to focus more on resurfacing the skin. Think like mid-level resurfacing. This is where we're going to still be treating pigment, but being able to treat a bit deeper, we're going to start to notice some more tightening, helping fine lines and wrinkles, and overall skin texture as well. So this is another patient of ours here at Cheng Plastic Surgery, and she had quite an advanced treatment here in the moderate setting. So you can see her progression. This is her before photo, post-op day one. She's has that bronze texture and that color to her skin. But just 4 days later, it's greatly improved, and a lot of that sloughing off has already been done. Now she just has some post redness left over from the treatment. And then by day 8, she looks fully healed. I mean, she looks amazing. So you can see that progression with this laser is that the main thing is that it's great results with a very little downtime compared to traditional lasers like CO2, which create a lot of heat in the skin and can have that longer downtime. And this is a close-up of her skin before and after. I mean, she's just looks so smooth afterwards. Her texture is amazing and improvement in overall complexion. Going over another couple other before and afters. For this patient, she treated around her eyes, and you can see the improvement in the fine lines and wrinkles. So if you look over here, there's quite a bit of lines in this area here. And in her after photo, they're still there, but they're much softer. So this is a great treatment for around the eye area, and it's safe to be done in this area. If you're having an eye treatment here at Cheng Plastic Surgery, we do put in surgical eye shields into your eyes. So surgical eye shields are sterile, they're safe to use, and they protect your eyes during the treatment. And that's super important to do. These lasers are very powerful, so your eye health is super important to us. So that's why we put in these surgical eye shields prior to doing the procedure. And this photo is showcasing how it can be used on scars. This is on the before photo showing an old scar. It's mainly white, but a little bit of pink underlying, and some scars will just stay like that over time. And this is 1 month post-op, only one treatment. You can see the improvement in the texture. It doesn't look as depressed, so it's actually smoothed that out quite a bit and even less red. And then 2 months post-op after 2 treatments, significant improvement in the color and also the texture as well. Okay, for this patient, she had, again, a more advanced treatment under the moderate level of settings. And there's nice improvement in her hyperpigmentation here on her cheek, along with some fine lines and wrinkles. You can see on her nose here, there's quite a deep wrinkle actually on the left side of her nose, on her nose bridge, and that's greatly reduced, a lot softer overall. Even some of these folds look a bit softer as well. And we're still only in the moderate setting.
And you do see improvement of her jawline or like tightening.
Yes. Okay, this patient had great results. Really nice improvement in hyperpigmentation, as well as the redness, and overall her skin just looks smoother. But really, if you take a look at the jawline here, there's some good amount of tightening here. And even though this treatment isn't meant solely for that area, we'll get to that later under the more advanced treatments, but you do see some tightening that's possible with under the setting of the moderate setting. This is another patient who had treatment around the eyes. Just one treatment, 4 weeks later, really nice improvement in those, actually, I would say these deeper wrinkles here around the eyes. Really smooth overall, and even some tightening going on there. So really nice. These lines are what's known as radial cheek lines right here. And it bothers a lot of patients. So here we can always combine different modalities together, but just having a laser that can do this kind of result is really amazing. And you can see in the after photo, just after one treatment, there's a huge improvement in those radial cheek lines here, much softer overall, and some of them have even disappeared. Okay, for this patient, they have quite a bit of hypertrophic scarring going on. So this could have been from acne. Um, you can see that deep pitted type of scars, and this laser is safe to use on acne scarring and great for that. There's huge improvement in the texture of the skin. A lot of those scars have actually lifted. If not, then they've gotten a lot smoother over time. So that improves how smooth they look and also how much light can come into that area. The more light that's able to shine on the face, the more smoother it looks. So you can see this scar here is almost gone after one treatment. So that's really powerful for this patient. This patient had treatment to the neck for the skin laxity in particular. And we can just showcasing, even under the moderate treatment, she's had amazing results with skin tightening. I mean, sometimes it's even difficult to get these results with surgery, let alone with the lasers. So to have being able to accomplish this with this laser is really amazing. Okay, this is showcasing an Asian patient with some acne scarring, mainly to the cheeks, and really nice improvement. Just 1 month later, one treatment, huge improvement to the scarring. You know, that deep pitted scar that we see on the lower cheeks here and here, much smoother overall, and they look, yeah, almost gone. For this patient, a lot of hyperpigmentation going on, quite a bit of redness as well. And after one treatment, just really nice improvement there. Reduction in hyperpigmentation, mainly on the temples and the cheeks here, evening out the skin tone, less redness, and even some skin tightening around the cheek area around here, where those radial cheek lines are. This patient had a really nice tightening in the jawline and also the under the chin area. A really difficult area to treat, but great results overall.
These are almost getting close to surgical results, which is really amazing from that standpoint. But prior, if we had, the only option for her with getting that much tightening in the neck would be surgery.
And that's a lot coming from our expert surgeon. I mean, she's saying that you can get these kind of results. I mean, that's saying a lot.
Yeah, and I think an important part of that too, for a lot of patients that are, they really are a surgical candidate, but just can't quite wrap their head around that quite yet because it can be scary. I think that that this treatment really will kind of give you almost like a stepping stone, buy you a little bit of time and just make you feel better about your skin. And yeah, if you can try and tighten things up a little bit too and push off maybe surgery for a little bit or combine it with surgery, I think there's a lot of options with this laser.
For sure. And you can see, and even in this patient, just really nice rejuvenated skin overall. I mean, the amount of improvement she has in her deeper lines and fine lines and pigmentation, she just looks 5 years, 10 years younger just after 3 treatments. Really amazing. Okay, so this is pretty exciting. We're getting to the advanced part of level of treatment, laser coring. So earlier, Dr. J talked about what laser coring is. It's basically when we use the laser to core out, so to remove a microscopic amount of tissue, skin, wherever the treatment is, and thus leaving the surrounding area untouched. And that's really important because when you have healthy tissue surrounding, it aids in healing. It makes healing a lot faster and also it decreases downtime as well. So we can see some before and afters with that. But before we do, we can show you the mechanism of action, actually how the laser works in removing these microscopic pieces of tissue. So I'll showcase that here in this video. So really cool on a microscopic level to see how the laser is punching tiny microscopic holes in the skin and removing that. But you can see the surrounding tissue is untouched. And because, again, this is a cold fiber laser, that heat is really isolated to that column there. We don't have that spreading out because when you do have that spreading out of heat, it's when you can cause more damage, more inflammation in the skin, more char. And when you have that, you are at increased risk for hyperpigmentation, for example.
With the coring, I mean, you're actually removing some tissue. So if you've got a lot of lax tissue, that's one way of tightening the skin, is actually removing some tissue. The other way is stimulating collagen. So ultra clear, the laser coring is doing both of those.
Okay, so this is going into some before and afters now. And again, this is the advanced level laser coring, which we're removing microscopic levels of tissue and really nice tightening. So this patient had only one treatment and just much more rejuvenated overall. She has nice tightening there. Her lines and folds are a lot softer, and she looks much more younger and more youthful.
And then with this laser coring, just something to keep in mind is your discomfort is number one for us, right? So we have many different ways to address that. In some cases, it may be done in the surgery center under anesthesia, like IV sedation. It may be that we medicate you. We have laughing gas. We have over-the-counter meds. So we really can kind of figure out the best option to keep you comfortable during the procedure.
For sure. And this doesn't, even though this is the most advanced level of treatment for UltraClear, it doesn't mean that it has to be done in the anesthesia room. We are
Right.
also able to provide nerve blocks as well, just with the lidocaine injections. So that way it can be done when you're still conscious, still awake. It can be done just depending on the patient's pain tolerance. Okay, so this patient here had treatment done to the neck and also the submentum areas underneath the chin. Really amazing tightening results you can see from her before and after. And I believe it was just one treatment. Yes, just one treatment 5 months later, and that amount of tightening, really amazing.
This goes to show that, when you make collagen, it takes time. It's really 3 to 6 months after the treatment that you really see that tightening. So you got to be patient with the process. But this is pretty amazing without surgery. If she wanted more, though, it would have to be a facelift neck lift.
Another patient here. Huge improvement in these deep lines and wrinkles here. I mean, these are static wrinkles, meaning that they're permanently etched into the skin. And really, before we just had surgical options to address this, or a CO2 laser, for example. But some people don't want, again, that long downtime. And not only is it long, but it's also quite painful, the inflammation that can be created by CO2 lasers. So having this laser on board, less downtime and an easy recovery process is a huge plus for a lot of our patients. Another really tricky area to treat and one that can age a lot of patients or make them feel like they're aging a lot quicker than they feel inside is around the mouth, so the perioral area. These are known as smoker lines, and a lot of patients even have them without ever smoking a cigarette in their life. They can just be created over time. People who end up pursing their lips a lot, for example, or who use a lot of straws over a period of time, just a lot of movement in general can cause this. And so now having a treatment that can be isolated to this area is really great.
And I think the one thing that you will notice from treating that, what we refer to as the perioral area, patients' options before that was again lasering and or dermabrasion, and in some cases you may see the change of color around the other part of the skin, but that wouldn't be the case with this because we can again do different modalities to different parts of the skin at the same time, where it wouldn't all require a full facial coring, but certain areas that need it can be addressed.
Exactly. Just highlighting how customizable this treatment is and how this laser is. Okay, this patient had treatment done underneath the eyes. you can see really nice improvement in those wrinkles there. I mean, it looks so much more smoother overall. And she only had one treatment, and this is 1 month post-op. So for a lot of patients where they feel like their under eyes make them look tired, even though they don't feel tired inside, great treatment for that. We can help to smooth out those under eye wrinkles, and even smooth out possibly some eye bags if they're in a very mild stage. All right,
Awesome.
so
That was fantastic. Thank you guys so much. Those results are phenomenal, and I cannot wait to get my treatment done. For everybody who's tuning in with us live today, we do have a special promotion just for you. We did decide also at the last minute surprise to bump it up to 20% off of your UltraClear treatment. Previously, it was 15, so this is going to be the best deal that you're going to get. Anybody who is booking will also receive a complimentary skincare gift. But if you guys are one of the first 5 attendees to book your treatment, we're also going to throw in 10 free units of Botox or Dysport. So I will pop a link in the chat here. Anybody who is interested in booking their consultation, go ahead and just fill that out, and our team will be in touch with you to get scheduled. And now we can go into my favorite part of the evening, the Q&A. A couple of them have already popped in there. So as everybody's filling out their request form for a consultation, if you have any questions now is your chance. So we'll go ahead and get started with a couple of these that have come in already. Let's see. Can UltraClear be used for under eye discoloration and wrinkles?
It can definitely be used for under eye wrinkles. Now, the discoloration, it really depends on what's causing this discoloration. Sometimes, we end up with dark circles because we have hollowing under the eyes or we have eye bags. So it really depends on what's causing it. The only way we're going to know is for you to come in for a consultation. We'll tell you what's possible.
Fantastic. How about with marionette lines? Will UltraClear help with those?
It can, if we can get super aggressive. Well, it depends on how deep the marionette lines are, right? So again, it's really what Fitzpatrick are you and how we can set the modalities to it. Because remember, laser coring, we can only use it on Fitzpatrick 1 through 3, but we can use UltraClear. We just have to see what your skin looks like.
Awesome. Let's see. Can you do UltraClear if you have an active acne breakout?
I would say that depends. If your acne is pretty well managed, you just have like a one-off breakout here and there, that's fine. But if you have a lot of active acne going on and that's not well controlled, we do not recommend that. We don't actually recommend that you have any facial treatments unless it's for acne until we take care of that first. It doesn't make a lot of sense for us to do a corrective treatment for acne scars, for example, or acne hyperpigmentation if your acne is not under control first. So that's always first and foremost here. We do treat acne here as well at Cheng Plastic Surgery. So if you have that skin condition, come and see us. We'll treat that first, and then once we get it under control, then we can talk about working in UltraClear to help with your post-acne marks.
Fantastic. Let's see. Does Dr. Cheng do this procedure?
I do. I do.
Mm-hmm. All providers here have been trained to do the procedure, including myself.
Fantastic. Let's see. Oh, this is a good question. Is summer a good time to have the procedure done?
I tend to not recommend laser treatments during the summer because the sun is so strong. I mean, that can cause discoloration. If you're someone who doesn't go on any beach vacations, hides out in your house, then possibly. But it's really, I prefer like someone doing it in the fall, the winter.
Yeah, I think that's an important factor too. What does your activity level look like, right? Are you paddle boarding, during the summer? Are you running? Like, what does that what does that physical activity and outdoor activity look like for you? Because for a lot of patients, they're really diligent about, wearing hats and protecting their skin, and then absolutely they can. So yeah, we're going to ask you some questions. What are your vacation plans, and where are you going, and what are you doing? Because for us, we want to set up uh, manageable expectations, right? And be realistic. It doesn't make sense to spend the money, go on a Hawaii vacation, and then, not really see the results you're looking for. So we would tailor the treatment based on, again, what your plans are, and when it makes sense for you to do the treatment.
Awesome. All right. So speaking of summertime, how long do I have to stay out of the sun after my treatment?
Well, in general, you should be really good about staying out of the sun, but most importantly, protecting, right? I mean, we have a lot of patients that come in and do a laser treatment, but don't wear sunscreen. Well, that kind of is, you need to do sunscreen, right? That should be number one. And so then it's not that you have to avoid the sun altogether. I was just in Arizona this last weekend, and I was really good about just protecting my face. And so it's not that you have to now never go out again, and you want to live. We live in California. So it's very unrealistic that we would not be in the sun, just making sure that you're protecting it.
For
Fantastic.
sure. And, to talk a little bit more about that, it's going to be really dependent on the patient. What Fitzpatrick are you? What does your activity level look like? When we say sun, we mainly mean like sunbathing. Obviously, you shouldn't be sunbathing, but doing your daily errands, as long as you're protected, you're wearing a wide-brimmed hat, you're wearing your physical sunscreen, that's possible to do.
Mhm. Awesome. Let's see. What about the average cost for the procedure? Are you guys able to share any pricing with us today?
Yes, so pricing will start at 800, again, depending on what we're doing, and we'll go from there depending on the modality, how many sessions, what are we doing for pain management. So there will be a range for that. And then ultimately, what is it that you're looking to improve on? So, package pricing, of course, will be available if more than one session is recommended for you. And yeah, so we'll go over that with you, but it does start at 800.
Fantastic. Okay, let's see. Another one came in here. How long do we expect results to last, and how often should we expect retreatment? Is it like Botox where the results fade and return to baseline?
Well, the results are gonna last, but we're gonna continue to age. So, if you want to maintain your results, then you're gonna have to repeat it maybe once a year to get that refresh. It just depends. But if you have results and you want even more results, we could repeat it at 6 to 8 weeks. So it really depends on what you're looking for.
Awesome. Let's see. Another one asking about how long it lasts compared to alt therapy. I feel like we kind of just hit on that one there. So obviously the different modalities or the different levels are going to have a varying repeat level. 3D Miracle, however, definitely something that you can use in your regular skincare routine. Just come in for it as that regular, that refresh basically for that skin health.
So just remember, Miracle is the superficial. That's what's probably, I mean, it's low down, not very much downtime and recovery. That's going to be like your $800. But as we get more aggressive, the cost does go up.
Let's see, what about downtime for laser coring specifically?
For laser coring, if you're going to do an isolated area, downtime could be a lot shorter just for that particular isolated area. But if you're doing a larger area, you're probably going to look at around 7 to 10 days for downtime. If we also pair that with different modalities, for example, if we core in one area and then we do an ultra in a different area, that can vary too as far as the downtime. You may heal quicker, or you probably heal quicker in the areas that we do more superficial and moderate treatments compared to coring. So you have different areas of when it's healing. But pretty much like about 7 to 10 days for laser coring, which is really not that significant compared to what it's able to do.
Let's see. Okay, so more questions about comparing it to all therapy. So maybe we want to kind of break that down a little bit as far as what those two devices do, what's so different about it, and how long the results would last from each.
So, all therapy does not treat that top layer of skin, right? So, it's not going to help with texture or pigmentation. You're really just trying to stimulate collagen formation. So, if you want surface changes, it's UltraClear. Um, with UltraClear, you're definitely going to see results from the standpoint that, yes, it's helping with that surface layer. Um, Both UltraClear and all therapy are going to tighten, but you're just not going to get the surface changes. And how long does it last? Well, it takes our body time to build up the collagen, 3 to 6 months. We continue to age, so every year we lose collagen. But it's not something that you have to repeat every 3 or 4 months.
Awesome. Let's see. Can I do UltraClear if I've had a facelift?
Yes, that is a good way to maintain the results of your facelift. Because again, we age with the facelift, we turn back the clock, but we will age every year from that. So Ultra Clear can kind of create some tightening and hold off on like a second facelift.
And I think part of just piggybacking on that too, we have a lot of patients that are coming into our office that are currently on GLP-1s, and we're seeing a lot of skin laxity and volume loss from those patients. And so these types of treatments, again, can help with those fine lines and just overall skin texture that seems to be sagging quite a bit faster than just even traditional aging, right? So we're seeing a lot of that. So for those patients that are more concerned about that and really want to kind of work on the surface of their skin and trying to tighten up overall, I think it will be a good treatment with that.
Awesome. All right, one more coming in here. This might be a hard one to answer without a consultation as well, but how long does the pigmentation lightening last?
That's a really difficult question to answer. Again, it's going to be based on your skin type for sure. Any products that we send you home with, we always set you up with products to be preventative and to slow down the process of pigment coming back into your skin. So, how good are you with your products? Sunscreen use? Are you using your sunscreen daily? What does your social life look like? Are you someone who enjoys the sun all the time? Are you someone who's a bit more of a homebody indoors? All of those play a factor in how quickly the pigment can return.
Yeah, and I think an important part of that too is being that the laser is, safe on all skin types. That doesn't mean that you have to do that you have to do some homework before that, right? You have to make sure that you're using the right products to suppress that pigment, because again, it doesn't mean that even though it's safe on all skin types, that you won't hyperpigment, right? So again, we will see you, we will follow up with that, but just knowing that you have to be patient with that part of that result that you may experience.
Yeah, here at Cheng Plastic
Trust
Surgery,
the
we always
process.
do it with success. So and after getting your optimal result, we will send you home with products to make sure that we're going to continue to not only see results, but for you to be able to maintain. Because what we do for you here is really important, but at home, using products to continue on with maintaining your results and preventing these sunspots from coming back, for example, is going to be the true investment in what you pay here to have these treatments done.
Awesome. Let's see. What about using UltraClear to increase volume underneath the eyes?
It's not really going to increase the volume, it's going to tighten the skin more. So that's where if you do need more volume, we may do fat grafting and then do ultra clear over it.
Mhm.
That's something we would determine at a consultation and we would let you know.
Awesome. I think that's all the questions and the time that we have for this evening. So everybody, thank you so much for attending. Thank you for all of the fantastic questions. Dr. Cheng, Kevin, Adina, that was a fantastic session. I appreciate it so much. Cannot wait to get my treatment done. I hope to see everybody in the office soon.
Everyone.
See all of
Thank
our
you so
patients soon.
much.
Bye-bye.
Have a great evening.